I really truly appreciate the ability to present for you today because this subject is very near and dear to my heart. It's allowed me to completely transform the way that I practice dentistry and the way that I feel joy within my own life. Today, there is a lot of talk in dental offices as providers about practicing self-compassion and finding grace and being able to live a good, balanced life. But we have left out of the equation the compassion benefits, meaning the compassion that we dispense to our patients in the dental setting and what benefits that has to us as a provider. So I start with this, and so I don't know how it is in other places around the world, but in the United States, patients have the ability to review their doctors. And whether it's positive or negative, they go on Google, they go on Yelp, they go on Health Grids, and they write something about the doctor. So once I read this to you, I'm going to pose a question for you. What happened in this situation? Was this a type of day where the patient was overly overbearing, requested too much of the doctor? Was this a day that the doctor was just having a bad day? Was it a combination of both? So this is the review from 2013, and it says, I wish I could give them 0 stars from lack of professionalism, lack of skill, especially the doctor dentist. I feel like my Invisalign was a total waste of money. Besides Invisalign, Dr. Dentist could not care less about my molar pain. She nonchalantly handed me a referral for a surgeon. And when I went, they told me they don't accept my insurance. I have told Dr. Dentist countless times that they don't accept it. What a waste of everyone's time. Don't go there. Go to a dentist that will appreciate your business and treat you with the utmost of care. Once again, I ask you, what do you think happened in this particular interaction between the dentist and the patient, and maybe also the team and the staff that was at the dental office? And I think your question will be answered when I present to you another set of reviews. These are from 2017 that say, Dr. Dentist, honestly, I thought the best from reading her website on the clinic on how she likes to help others, but actually I met her. She seemed bothered by something, wasn't smiling, and made me feel bad, not a good experience. Earlier in 2017, I agree with others about how unprofessional she was. Never smiles, definitely not the friendliest person. We go a little bit earlier than that. Is agitated by everything, seems very rushed, not terribly proficient, and not patient-oriented. Please go find other dentists. I am out. And then the next one, office is gorgeous, staff is wonderful, experience not too bad. Doctor, once again, annoyed, standoffish, yelling at the staff, poor treatment of staff members, pushy about treatment. And this was in 2018. And I think when you see this, you start to realize this was not a one-off. This was not a bad day for the dentist. These were not overbearing patients. This was a doctor that didn't want to be there. This was a doctor that felt most likely burnt out, that was suffering from compassion fatigue. And all of these, because I'm saying they weren't overbearing patients, all of these reviews were true. And the reason why I know they were true is because they were written about me. These patients were writing about me prior to 2018. I had a shift in my life. I went through cancer, and after cancer, when I'd woken up on the other side, I did not want to go back to being the same person I'd been, the burnt out, standoffish, annoyed, never smiling dentist. And so I needed to look in, and I needed to research on how to come out of where I was. And I had written this article around that time, which was called Dentistry Made Me Hate People. And it published in Dentistry Today, which is a journal, it's a magazine in the United States. And it went viral. Within an hour, it had thousands of views, and it's probably been read 20,000 times up until now. But I lied when I said for a moment, because Dentistry made me depersonalize relationships with my patients for a very long time, probably for more than a decade. And before we get into how I got out of it, I want to review with you the difference between sympathy and empathy, because some people use those interchangeably and they really aren't. Sympathy means, I am sorry that you're in pain. And some people might say, you know what, it sucks what you're going through, but guess what? My Aunt Joe had it worse. Empathy means, I'm sorry you're in pain, and I feel your pain. And then when we move into compassion, compassion means, I'm sorry you're in pain. I feel your pain. What can I do to help? And that's a lot of what I'll be talking about in today's lecture, is utilizing compassion. I feel you. How can I help? So I went back to the life that I was living and I started to consider, what was it about me that they didn't like? And for a long time, as you could tell, I thought it was on the patient. I thought I was seeing the wrong patients. It wasn't until my eyes were open and I was able to look inward that I discovered that, well, there was a disconnect and I had the load, the heaviness to bear that disconnect myself. If we go back to 1951, Dr. Parsons, a sociologist, talked about an active role of a doctor and a passive role of a patient. And what he discovered is that each had their own obligations, rights, and representation. The doctor was owed a reward for all the hard work of becoming a doctor. And that status is what was a carrot for the future generations to become a doctor. The doctor was a trained authority. And what was really sad is that the doctor was a gatekeeper between health and sickness. But the rights and obligations of the doctor as an active role were that they had to be emotionally detached, and compassion was frowned upon. It made you common, and becoming a doctor was not common. And so where did that put us? This was 1951. I was under the tutelage of an older doctor, very, very successful doctor. I graduated dental school in 2004. 2004. Consider that's 55 years later, and I was still taught to present into the operatory with a well-ironed coat, to stand straight, to be stoic, to only show a very mild amount of emotion, but above all, to appear educated and to make sure that my patients knew that I was above them, that I would use medical terminology that they might not have ever heard of, and that is how I would show them that I knew more than they do. But not much has changed, because this is a clip from Grey's Anatomy, which is a show in the United States, that went on, this is probably a little bit after 2020, this episode, or I'm sorry, after 2005, this episode, and you'll watch this. This is pretty transformative. And that's bad. When you get emotional, that's bad. You should only show a mild amount of emotion. From the patient's perspective, this was also studied. In 1988, there was a study that came out that showed that there is an imbalance between the patient and the doctor, and that the patient was, in fact, passive. They were unable to ask the doctor questions. They were intimidated by the doctor. In this study, it showed that 47%, a little less than half the patients, did not understand their diagnosis because of insufficient or inadequate information change. So everything that I had been taught, everything that Dr. Parsons taught in 1951 and what I was taught in 2004, it didn't make sense in terms of providing patients with the greatest care that we were able to do. In 2002, the American Dental Education Association listed empathy as one of the most important clinical competencies in dental training. And that was phenomenal. Even though I graduated in 2004, this was never infused into my education. And what's really sad is that since that was publicized, that clinical competency of empathy has been removed. And that may not have been a great decision, because in 2014, in a study, it was shown that communication between dentist and patient was the weakest aspect in modern dentistry. Think about it yourself. Have you been taught about compassion or empathy in dental school, or even in any of your courses or interactions with colleagues following? In 2005 came out a study about the decline of empathy, and they talked about the highest level of empathy in our dental training being in the first year, and it dropped off every year following. In fact, it was lowest in those dentists that finished their specialty programs. Why such a steep decline? Well, in our predoctoral education, we are taught science. We get admitted into dental school, at least in the United States, because of how well we know science. There is very few programs that request or require sociology or psychology. You can enter a program in the United States not being a science major. You can be a history major, a music major, but you have to have a lot of predoctoral science education. And I would gather to guess that most of the students entering dental programs have their basis in dental, in science education. When we are in dental school, we are procedurally driven. It is not about patient interaction. It is not about serving our patients. It is how many crowns have you done? It is how many root canals have you done? It is how many deep cleanings have you done? And can we move you into the next grade? Also, because of the increased technical demand during our dental training, I don't know how many of you, but I know that my second year, I was in school probably at least 12 hours a day, 6 days a week. That is exhausting. And that leaves very little margin for us to learn anything else. We need our credits, and that outweighs the needs of what it is we are there to deliver for our patients. We also put priority in developing and maintaining relationships with our colleagues, with our peers, and with our professors, and not so much on our patients. If you've ever experienced spending time with a patient, showing them all the options, really holding their hand through it, only to have them walk out and not to follow through with that expertise, that is also part of the reason non-compliant patients reduce our empathy. But as brand new providers, there's a fear and an insecurity about what we provide our patients. I mean, we're not as good on day one as we are in year 20. And we want to build a wall of separation because of our own insecurities. And there's also, like Dr. Parsons said, a sense of belonging to an elite group that reduces that empathy. So now that we have a really good foundation on why do we act the way that we do, where did it come from, how we continue to have the low amount of empathy and compassion throughout our training, and after, let's talk about the science of compassion. This is a great study, 2011. Prior to this study, we thought that compassion and empathy were human. They were not necessarily infused in our DNA. They were part of being human. And in this study, we discovered that that might not have been the truth. There were 2 rats that lived together for 2 weeks. I called one Chris, that was the caged rat, and one Frank, that was the free rat. And so they were together, spending time together for 2 weeks. After that 2 weeks, one was separated from the other in a plexiglass cage. But Frank, the free rat, learned to open the cage, Chris, the caged rat, and he let him out. And then so sometimes Frank, the free rat, would get a reward for that, and sometimes he wouldn't. And he would open the cage for Chris, the caged rat, regardless of whether or not he got a reward. And then when presented with either opening the case for the caged rat or opening the case for a tasty treat, He did that indiscriminately, regardless of the treat. And this was that study that showed us, okay, this is compassion and empathy is not innately human. It is mammalian, at least according to this study. In a 1992 study, this was an accidental finding, which I find so beautiful about this study. There was a monkey that was being studied whose brain was connected to a computer in order to read his brain waves and to be analyzed. And so one day, a scientist was looking at the monkey and eating his lunch. And what he noticed was that as he was eating, the brain waves and patterns were identical on the screen to the way that the brain patterns would have been if the monkey was actually eating the sandwich. And that's when the idea of neuron mirroring came out, meaning when I see you, I feel you. Okay. Let's talk about a little bit more science on this. When I see you, I feel you. In 2014, there was a study that looked at participants who were viewing videos of subjects that submerged their hands in cold water and in warm water. And the study found that the participants who watched the videos of cold water submersion, okay, nothing happened with their hands, but they just watched the video of the cold water submersion, their hand temperature was lower compared to the control group. And every now and again in this lecture, I'm going to specify some sort of a quote that I felt connected to in this lecture. I think that when the dust settles, we will realize how little we need, how very much we actually have, and the true human nature and the true value of human connection, neuron mirroring. I see you, I feel you. This was really groundbreaking. 2012, the Journal of American Medical Association released an article that was from a point of view of Dr. Elizabeth Tull, and it was called The Cost of Technology. Now, think neuron mirroring again. Think I see you, I feel you. And in this article showed up this picture. It was a picture that was drawn by this girl that you see on the examination table, her sister and mom sitting in the room with her, and the doctor typing away on the computer. And when the doctor looked at that picture, he was shocked. And this is part of what her article said at the end there. No one was more surprised than the physician himself. The drawing was unmistakable. It showed the artist, a 7-year-old girl on the examining table. Her sister, her older sister, was seated nearby in a chair, as was her mother, cradling her baby sister. The doctor sat at the computer, his back to the patient and everyone else. All were smiling. The picture was carefully drawn with beautiful colors and detail. You could not miss the message. When he saw the drawing, the physician wrote a caption for it. The economic stimulus bill has directed $20 billion to healthcare information technology, largely funding the electronic medical record incentives. I wonder how much this technology will really cost. How much is it going to cost when we disconnect from our patients? How much is it going to cost when we are no longer making eye contact with our patients, when we are no longer participating in the neuron mirroring with our patient? Neuron mirroring, our ability to talk to patients and connect with them in a compassionate way, is reduced today in clinical practice. It's reduced because of technology. I don't know about you, but when I see a patient, sometimes I have to go through multiple screens, my old notes, medical history, a physician's letter in a request to a medical consultation, radiographs, CBCTs, scanned models. And so while I'm going through all of these screens, I am not making eye contact with my patient. I am not looking at them. And very often they are speaking as we're looking at this, reducing neuron mirroring. In the United States, there's a significant reduction in reimbursement by insurance companies. And that means we have to see more patients. And that means we have less time to spend with every patient. That reduces neuron mirroring. And in dentistry, that's a special animal. We are focused on the mouth and not the face. Certainly when you're drilling on the tooth, you do not want to be making eye contact with your patient. We are constantly in fast forward. We live very, very busy lives. Again, removing that compassion, that neuron mirroring that is so very much needed in our lives from our practice. Social media has a place in this also. If you've ever been on any social media boards like Facebook boards, I don't know how many other countries have them. We have a lot of them in the United States. What you'll start to notice is that people are really cruel. Human adults are really inappropriately belittling and belaboring their colleagues. And why is that? And why does that happen with our kids too? It happens because when we write those nasty things on the keyboard, we can't see the face and the hurt that we're causing the other person. Because if you said a hurtful thing while you're looking at someone, because of neuron mirroring, you would feel a modicum of discomfort as you hurt that other person. And the last thing is Botox in face. I myself get 200 units of Botox every 3 months because of migraines. And so part of my face is frozen and not able to communicate adequate emotion. We talked about neural mirroring. We talked about the reasons for which we don't utilize it in our practice. But let's talk about the benefits of compassion as we're using, if we were to be using more neuron mirroring in our practice. 2004, we knew that compassion helps with healing. Although this is not something that we were ever taught in dental school. This was a study that talked about the pain administration, the pain medication administration. And in this study, people were divided into 2 groups. One received the analgesic just from the infusion from the machine. And the other group, a nurse came in and announced, I am about to give you a powerful analgesic that will take away the pain. When the 2 groups were compared, it was shown that the patients that got the analgesic through the infusion machine needed 50% more of the painkiller than the nurse that came in and made that announcement. Compassion and anxiety. This one I can very personally relate to. This was in 1999. This came out and it studied 210 women that had breast cancer. Of course, they were going to be anxious. 57% of those women tested 75th percentile for anxiety and 18% 99th percentile. Now, all women in the study received the same information about their treatment, risk benefits, survival rates, and possibility of side effects. But the first group refused that information with no empathy, very, very matter of fact. And the second group received that information infused with compassionate language, both before and after all that technical information was found. And the study showed that Group B, which is the group with the compassionate language, showed a measurable, significant, and statistically relevant decrease in anxiety. And on this particular issue, I want to share with you one story that I had with a patient just 2 weeks ago. The patient came in, she hadn't seen a dentist in 7 years. She hadn't seen a dentist in 7 years because she was suffering from PTSD that began 7 years ago when she was in a very vulnerable position in the dental chair, and the dentist continued to work through her pain, finishing a root canal as she was in an extreme amount of pain that caused her to withdraw her trust from the dental provider and to stop coming. She couldn't go on anymore because she developed a very severe, significant, painful infection. She came to see me. On that first appointment that I saw her, she said, I can't live through another root canal. I don't even know how I'm going to live through an extraction. I gave her a series of options, one of which was to hire an anesthesiologist to completely put her under while I performed the procedure. This woman was a single mom of 3 kids, and the hiring of the anesthesiologist would have cost $3,500 US, which is a lot of money. Sometimes it's the amount of money that somebody makes in 1 month in the United States, and that was probably her case also. The other option I told her was to put her on Xanax, an anti-anxiety medication. And as much as she wanted to go with the anesthesiologist, I convinced her to go with the Xanax. And during the procedure, well, before the procedure, she took the Xanax. She was okay. She cried a little bit, but was okay. I tried to keep all of my instrumentation below the gaze of the patient, but somehow she moved her head and she saw me holding an endo file. And PTSD trigger, she started to shake. She started to cry. She was almost inconsolable. I looked at her, I lowered my mask, and I held her hand. I looked in her eyes. What's okay to do in these situations is you mirror the emotion of the patient. And this is very much against what Dr. Porson says. But as I looked at her crying, my tears came to my eyes. I welled up and she was able to see that. And I said, I've got you. You are numb. I am almost done. If you have not felt anything up to this point, that is proof to you that you won't feel it again. It is okay if we take a break. It is okay if we stop altogether. But I am telling you that you are strong enough to get through this. And she looked at me. She requested about a 5-minute break, and we were able to finish the treatment. The next day, she sent me this message. My jaw and gums are swollen, but okay. Thank you so much. I 100% trust you. I don't think I even need Xanax anymore. Think about lowering the patient's anxiety simply by holding their hand and making eye contact. That is the epitome of compassion, of empathy, and of neuron mirroring. But now we come to the most important part of the lecture. Being a healthcare provider is really exhausting. And it's hard to continue to give to people when you are afraid at the edges. And you saw me going through that almost 10 years ago. A study in 2017 showed us that there are very real benefits to compassion to the provider. Burnout, compassion fatigue, it leads to depersonalizing human relationships, which is what I was doing 10 years ago. But rigorous systematic review on burnout reports that relationship between compassion and burnout is actually inverse. The more compassionate we are, the less burnout we experience. And really, for most of us, that is very counterintuitive. In 1998, there was an article that came out about a helper's high, which said that there's an inner calmness and an increase in self-worth as we help other people. And 70% of those that help someone else in a meaningful way experience a feel-good sensation. More studies on this subject, 2018 and 2002, show when you are down, you may be uplifted by picking others up. And this was directly related to depression as well. Excuse me. You forget your own worries as you're helping others. And that's a very healthy distraction in those that suffer from depression. And then in 2015, there's 2 studies that came out that had to do with the vagus nerve, oxytocin, and dopamine. Compassion activates parasympathetic nervous system by increasing vagus nerve activity. And compassion boosts modulators like dopamine and oxytocin. There is scientific proof that shows that if we exude or infuse our care with compassion and with empathy, not just the lives of the people that receive it change, our lives change. And so the next question that is probably looming in your head is, with what time? How am I going to find the time to do this? All of these studies right here show that all that is needed is 40 seconds of your time to make a difference in somebody else's. And that story that I told you about the woman who had PTSD on account of root canal therapy, I can't tell you that the conversation that I had with her as I was holding her hands took longer than 40 seconds. I think this is a great description of empathy. See the light in others and treat them as if that is all that you see. So, how do we move from the model that Dr. Parsons presented in 1951, a model which we are still probably taught in dental school, to infusing our practice with compassion? Well, we have to practice it. It is not a skill that is innate to us, but it is a skill that is genetically infused into our being, as we saw that rodent study. The more we practice, the better we're going to be. This is hard to ask, but slow down, at least in those really important conversations. Turn yourself from the autopilot. And I'm not just saying that because the patient is going to benefit from that. They absolutely are. What's more important in this setting, as I'm presenting this to you, is that you are going to get better if you slow down and turn off the autopilot. Stay in the moment with your patient, turn off the past. Don't think about the future. When you are with your patients, look at their face, look at their eyes, read their entire body language, touch their shoulder or their arm as you're speaking to them. This is extremely important as part of that empathy and compassion. Not only do I ask that you make eye contact when the patient is speaking, but listen generously, listen to understand what they're saying and not to reply. There was a study, and I don't have it here, that talked about how frequently healthcare providers interrupt their patients as they're making their chief complaint. And if you were in the audience, I'd ask you to tell me what you think that number would be. But the number of seconds before the doctor interrupts the patient in their chief complaint is 9. It takes 9 seconds of a chief complaint before the doctor stops the patient. And you're thinking, well, they could go on for half an hour. In that same study, it was shown that if the patients were able to continue speaking, they only went on for 23 seconds. So listen generously, listen to understand, and not to reply and not to interrupt. Consider the language that you're using. Consider your tone of voice. Imagine that you are taking care of your mother or your best friend. Truly get yourself in that position before you enter the room. Treat others as you would like to be treated, but most importantly, your desire to infuse this into your practice is what's going to make the biggest difference. So where are we now? Well, these are the newer reviews from my practice, and you'll see compassion and empathy fused into these reviews. Exceptional care and support. Your presence and professionalism truly made a world of difference. I was unprofessional before, and that was mentioned more than once. Warm smile and calming demeanor. Complete opposite from what they were saying about me 10 years ago. Explain all the necessary procedures. This goes back to that study where 47% of patients did not understand their diagnosis in a way that I could understand. I can now confidently say that my anxiety has diminished significantly. This review shows the complete turnaround and my ability to practice empathy chairside. She's been so good to my family throughout the years and has genuine interest in their personal growth. Such a caring doctor. I never had a dentist that I enjoyed as much as going to see Dr. Augustyn. She was able to see that I am not confident in my smile. Why do you think that was? That was neuron mirroring. That was me reading his body language. I always thought this is what dentists were for, and I regret that I hadn't found out about Happy Tooth earlier in my life. You will not find a more professional dentist or doctor anywhere. Dr. Maggie is so caring for her patient. Doctor goes out of her way to make sure everything is taken care of, the treatment. She will call her patients after procedures to see how you are feeling and if there's anything that she can do for you. This again infused with compassion. But I want to go back to that 40 seconds. Now, I will be transparent with you, and I will say that my life has changed quite a bit over the last 5 years or so. But around the time of the pandemic, I started making these videos for every patient that I saw. It was every patient that has either every new patient that I saw that day or any patient that had any anesthetic. And I would make myself record a video that was no longer than 1 minute, and it would be like this. So I would send these messages from my personal cell phone that I've had the same number since 1997. And this number has never been abused. And so when I ask patients to send me a message back, they usually text me back. But this patient, Phyllis, sent me her own video message back. I wanted to follow up with you about Monday's appointment. I'm so incredibly proud of you because you did an incredible job. You did what was right in your mouth. You took a risk. You took a chance. You followed through. And again, kudos to you. I wanted to check up on you though, and I want to make sure that all the numbness has worn off. I want to make sure that your bite feels the way that it should, because you were numb all over your mouth, and sometimes you lose muscle memory when you are putting your teeth together. I want to make sure that you are pain-free and that sensitivity is gone. Please send me a message back. Let me know how you're doing. Let me know how you're feeling. This is my personal cell phone number. If you ever need anything, put it into your phone. Do not hesitate to reach out to me. Thank you. Okay, this is Phyllis. Hey, Dr. Augustyn, this is Phyllis. I just load the picture messages that you sent to me, giving me loads of encouragement, and I had to figure out how to do this thing. So I had a little help. So I just wanted to say thank you so much for everything. On the road to better, on the road to feeling good and happiness and peacefulness. It's been a long road, but you know, I'm keeping it moving. And sometimes it's a little less fortunate, but I take everything in stride in the best way that we can. So I just wanted to say, throw that back at you to live, laugh, love, and pray. And until we meet again, which will be next week, to get the other side done. And then after that, we're going to be able to go to the Dells to enjoy love as a family coming back together. Blessings to you and yours. Hugs and prayers. Thank you so much. Bye. So I'm sorry I didn't use my language when I was saying this back to you. It was not infused in empathy, but I was trying to remember this as much as I could. Again, another quote that I really like: risk more than others think is safe, care more than others thinks is wise. Care more than others think is wise. Care more than others think is wise. Dream more than others think is possible. Expect more than others think is possible. A lot of the research that I have presented and a lot of the ways in which I have changed my practice has to do with this really, really good book called Compassionomics. And this is very true. The happiest people are the givers, not the takers. And they're the givers because generally giving is infused with empathy and it heals us as much as it heals others. If you have any questions about anything that I have presented today, or if you want to be a part of this conversation, please send me an email. My cell phone is on the bottom. Like I said, I've had it since 1997. That's not going to change. You can email me at drmaggie@myhappytooth.com. The QR code will take you to my personal website, and also my professional website is myhappytooth.com. I truly and sincerely thank you for the time that you have given me, especially the opportunity for bringing this very, very, very important idea front and center as we continue to practice and improve dentistry worldwide. Thank you.